Because of anything today, we've been here some other years past to celebrate, to commemorate the International Pathology Day. The College of Nigerian Pathologists, CNP Kwara State Chapter, this is why we're here. They all invite us here today. And today is the 13th day in the month of November, the year 2024. I'm here again standing before you. This is not my first time here anchoring this program. And it's my great honor to be here again today. Please, let's give ourselves a round of applause for being here today. If you're happy to be here today, please give yourself a round of applause. Thank you very much. We have a lot to gain from this program today. But before we start the program proper, I would like to appreciate both in absentia and those that are present here. The Chief Medical Director and Chief Host of this program, Professor Abdullahi Da Silva Yusuf, in absentia. The Chairman, Medical Advisory Committee, CIMAC, Professor S.A. Biliamino, in absentia. The DCMAC Clinical, Professor M.B. Abdul Kadri, we're still expecting him to be here too. And we equally have, in this great hall today, he's here already, our guest speaker, in person of Professor S.S. Taiwo. Please stand up for recognition, sir. Thank you so much. And we would like our guest speaker to proceed to the high table. Thank you. Let's appreciate him, please. We have a special theme to be discussed today. And apart from this special program, the topic we'll be discussing, we'll be honoring some great personalities today, and they are here seated. We'll be honoring 3 personalities, but we have 2 of them seated here already. And once I call your name, please, sirs, kindly proceed to the special corners over there. Professor E.O. Afolayan. Professor E.O. Afolayan. Let's give him a round of applause, please. That's one of our honorees. Thank you so much, sir. We appreciate you, sir. We equally have Professor C. Nwabusin. Professor C. Nwabusin. Charles. Ibo Kwenu. Ibo Kwenu. Ibo Kwenu. Thank you so much, sir. Otutu Oma, sir. Yes, we'll be inviting to the high table now the chairman of the College of Nigeria Pathologists, CNP Kwara State Chapter, Dr. Abubakar Akambi Sulaiman Kolako. Please proceed to the high table, sir. Thank you so much, sir. Please, if you're here, kindly rise up for recognition once I call your name or your title. The HOD-ONG. Please rise up for recognition, please. Thank you so much, sir. We have the HOD surgery. The HOD surgery being represented by Dr. Oseni, who is the representative of the HOD surgery, Dr. Ismail. Please kindly move forward. Thank you so much, sir. We equally have the HOD nursing, UITH. HOD nursing, UITH. Thank you very much. I would like to invite to the high table the chairman of education, Professor of Medicine, Sir Professor Adindu Ahioma Chijioke. Ibo Kwenu. Otutu Oma, sir. I would like to recognize the HOD Nursing University, Unilorin, If you're here, please kindly rise up for recognition, please. HOD Physiotherapy, Juni Lorry. Let's appreciate him with a round of applause, please. Kindly proceed forward, sir. Thank you so much. We have the HOD Physiotherapy, UITH. HOD Physiotherapy, UITH. All right, thank you. HOD Medical Lab Science, Unilori, professors. Okay, we have the HOD Medical Lab Science, Unilori. Our professors here present, please, if you're here, rise up for recognition. Professors here present, please. Every professors here present. Let's give them a round of applause, please. Every professors here present, please kindly rise up for recognition. We appreciate you all. Thank you, sirs. We have the HOD Physiotherapy UITS. Okay, Unilori, just joining us. HOD Physiotherapy, Professor Olusheye. Please rise up for recognition, sir. Professor Olusheye, thank you for coming, sir. We recognize the Chairman, Association of Medical Lab Science, AMLSN, Kwara State Chapter, in absentia. Chairman, Association of Medical Lab Technicians, AMLT, Kwara State Chapter. Please rise up for recognition, sir. Thank you so much for coming. We appreciate you, sir, and ma'am. Directors, Medical Lab Science, UITH, and other members present, please rise up for recognition, please. The directors, Medical Lab Science, UITH, thank you so much for coming. We appreciate you, sir. The president of ILAMSA, president of ILAMSA, thank you so much, sir. You're welcome to this occasion. All students, nursing, medical lab science, physiotherapy, please rise up for recognition. All students here present, rise up for recognition. Thank you so much for joining us on this occasion. It promises to be an engaging one and an educative one. You're welcome. All media personalities here present, we appreciate you for joining us. Our photographer and the videographer, thank you for joining us as well. It's going to be a memorable one, so help us to record it well. We have a lot to learn from this occasion today, but while we are still awaiting some of our guests to be here, I would like to make it a bit lively. I'm sorry to say, I will give the microphone to anyone, just anyone. It could be a student, it could be a physiotherapist, it could be a pathologist, whatever you are. Please, once you're given the microphone, we would like you to share with us the most memorable moments you've ever had in the course of your profession. Whatever it is, we would like you to share it with us. And what message do you have for the young ones coming up to be like you? Whosoever I decide to give the microphone to, please kindly do justice to the question being thrown at you. Should we go by ladies first? Ladies first. Ma. We would like you to share with us your name, your portfolio, and we would like you to share with us the most memorable moments in your life, in the chosen career.
Good morning,
What
everyone.
message you have for upcoming ones who want to be like you?
Good morning, everyone.
Good morning, ma'am.
All professors and their consultants present here. I'm glad to be here, and I'm so happy to be part of this program. My most experience time in working with the hospital is interacting with patients and helping them one way or the other. I'm so glad the way they react the way I interact with them, the way I, encourage them, because most patients, when they come to the hospital, some comes with a burden in their hearts. But when I receive them in the reception, the way I interact, the way I encourage them that they should be calm, especially when they come for their laboratory tests, maybe looking for their results after the investigation, looking for their results, the way I assist in getting it and making sure that they see their doctor, they used to be very happy with me. And I'm also happy with them because they get the good results in which they want to attain in the hospital. My advice to the upcoming one is that we work in an environment, we deal with human, we work in an environment that we should encourage our patients one way or the other. We should not be aggressive to them. We should try and be good listeners to them. We should try and assist them one way or the other, so that, as they go back home, they will be happy. They will be happy. And even the sickness that they brought, the way we interact with them, the way we talk with them, the way we encourage them, it will speak more to our patients. And when they get home or when they get to their doctors, they will be happy. Even with the drugs given to them, with the happiness in them, they will, really appreciate the way we interact with them.
Let's give her a round of applause, please. Thank you so much. I believe that is encouraging for each and every one of us. Thank you so much, ma. We appreciate you for saying yes to our question. All right, we're moving on to the next one. The question might change this time around. I'll be giving the microphone to someone else. And I think it will be a father. And I would like our father in the house to tell us the funniest moments he had in the course of doing, discharging his responsibility as a professional. And what does he think the young or upcoming ones who want to be like him, looking forward to be like him, would need to do in some kind of situation like that to maintain his or her balance and keep going no matter the situation? Sir, over to you. Thank you very much, sir.
The chairman, members of the high table, our distinguished pathologist, and our dear invited guest. I must say that the MC caught me unaware. But I heard her saying the moment of joy, the funniest, yes, the funniest moment. When I started the residency program, somebody was just employed into the department. And when it was time to gross, he wanted to assist me, and I invited him. Luckily, in the grossing room, there was hair extractor. So he could not smell the formalin. So in the course of grossing, I asked them to give me additional formalin. And the formalin was so clean and clear. And the chap said, "Oga, this is drinkable." I just laughed. I said, sheer ignorance. I didn't show any expression. You want to drink poison? Say, what do I mean? So at times, in the course of our practice, you come across a situation where, out of ignorance, somebody will utter one or two statements with the maturity and self-discipline, you should not descend heavily. Rather, try to educate that person. And I'm sure he will be moving along. In my own area of specialty, that is one thing. But at times, even when you are taking students, you see all sorts of funny characters. Remember, as a lecturer, as a consultant, you are supposed to be a good mentor. Show that maturity. You show them the way. You teach them how to do and how to prolong along their career as well. As I am today, I'm deeply happy because I've tried as much as possible to be a good mentor. And I could see my young ones even already overtaking me. So, and that is how it should be. The joy of the moment. And I'm sure this is one of the reasons why we are being honored today. Thank you very much.
Let's appreciate our father. Thank you so much for that insightful experience you shared with us. That's a great one. We appreciate you once again. Let's give him a round of applause, please. Thank you so much, sir, for saying yes to our questions, sir. Thank you very much, sir. So, since we have some of our personalities seated at the high table already, and we have our guest speaker seated, we have most of the audience here available for the program, I think we should proceed with the program of the day. If time permits us, we may still need to invite some students to talk about their experience and what they want to learn from the leaders that they are looking up to later in the course of this program. Shall we all rise for the opening prayer? We are starting the program proper. Mr. DJ, I hope you're almost ready. We'll be taking the national anthem as the opening prayer. But before we proceed, let me recognize the presence of our representative of the HOD Nursing, in person of the Deputy Director of Nursing, DDN, Molade Rebecca. Please proceed to the high table, ma. Let's appreciate her as she proceeds to the high table. Thank you so much for coming, ma. Shall we all rise for the opening prayer, which is the national anthem? In case, we cannot really, read the anthem. The opportunity is given to us, straight before us, so you can read along. After the count of 3, Mr. DJ, please give us the national anthem.
Mr.
Are we ready,
Congo
sir?
raises the flag of the
1,
nation.
2, 3.
Nigeria.
Incoming call from Topiuth identified by true. Incoming call from Topiuth identified.
In brotherhood we stand.
Incoming call from Topiuth identified.
Nigerians old and proud to serve our sovereign fatherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed.
Thank you so much. Let's give ourselves a round of applause. We are all great Nigerians. We're all looking forward to a Nigerian where no one is oppressed. May we get to that level by the grace of God Almighty. Thank you so much once again. Now let's proceed to the next agenda, which is the opening remarks from the chairman, College of Nigerian Pathologists, Kwara State Chapter, in person of Professor Abubakar Akabi Sulaiman Kolakpo. Over to you, sir.
The chairman of this occasion, our teacher and father, Sir Professor Adindu Chijioke. The guest lecturer, Professor S.S. Taiwo. Other members of the I table, our fathers, our retiring professors, the HODs and other professors, distinguished and seasoned professionals, students, other invited guests, distinguished ladies and gentlemen, good morning. It is both an honor and a privilege to stand before you as the chairman of our local chapter of the College of Nigerian Pathologists on this important occasion of World Pathology Day 2024. This annual celebration is not only a testament to the essential role the pathology plays in the healthcare ecosystem, but also a reminder of our commitment to advancing health outcomes through diagnostic excellence. Pathology, as we know, it's okay. Pathology, as we know, is a composite laboratory discipline made up of 4 distinct specialties of anatomic pathology, also known as histopathology, concerned with autopsy practice, tissue diagnosis, and here in Nigeria, cytopathology. Hematology and blood transfusion, concerned with blood, its products, and related disorders. Chemical pathology, also known as clinical chemistry, concerned with metabolic disorders, toxicology, and immunology. And finally, medical microbiology and parasitology, concerned with infestation and infectious diseases. As pathologists, we work behind the scene, often unrecognized by the public, yet our impact is profound. From early detection of disease to guiding personalized treatment options, our work form the backbone of clinical decisions. Here in Nigeria, where resources and accessibility can be challenging, our role becomes even more crucial. We carry the responsibility of pushing forward with innovation, advancing for better infrastructure, and educating the next generation of pathologists to ensure our profession remains a pillar of Nigerian healthcare. This year, the theme, the rise of global antimicrobial resistance, could not be more timely or relevant. Antimicrobial resistance represents one of the most formidable challenges to modern medicine, threatening to undo decades of progress in the treatment of infectious diseases. Pathologists, especially microbiologists, stand at the forefront of this global crisis, leveraging our expertise in microbiology, molecular pathology, and diagnostics to identify resistant patterns and guide effective treatment strategies. In Nigeria today and across the globe, we face a double-edged sword. On one hand, the rampant misuse and overuse of antimicrobials, and on the other, the critical gaps in diagnostic capabilities and antimicrobial stewardship. The impact of antimicrobial resistance is felt acutely in our clinical practices, where treatment failure are becoming alarmingly common, leading to prolonged hospital stays, increased healthcare costs, and sadly, preventable loss of lives. Our gathering here today, therefore, serves as a clarion call to action. As pathologists, we have a pivotal role in addressing this crisis by championing accurate and timely diagnostic services, which are essential for targeted therapies, strengthening laboratory surveillance system to track resistant patterns, collaborating with policymakers to advocate for effective antimicrobial stewardship programs, educating clinicians and the public on the prudent use of. The fight against antimicrobial resistance requires a united multidisciplinary effort, and we as pathologists are uniquely positioned to lead the charge. Let today's event inspire us to deepen our commitment, innovate our practices, and amplify our voices in a global effort to combat this silent pandemic. The sub-theme of this year's celebration is teamwork in clinical practice, a sine qua non for patient safety in diagnosis and management. This has also been carefully chosen to bring together erudite and seasoned hospital professionals and administrators to brainstorm on issues of patient safety as it relates with diagnosis and management. It promises to be informative and educative. As we proceed with today's activities, let us celebrate the vital role of pathology in healthcare, reflect on our collective achievements, and explore strategies to confront the challenges posed by antimicrobial resistance. Together, we can make a lasting impact and ensure that the next generation inherits a healthcare system that remains resilient in the face of evolving microbial threats. Today is a celebration of our accomplishment, a time to reflect on the journey that has brought us here, and a moment to look ahead at the work that still needs to be done. As we celebrate, let us also recognize and honor the dedication of every pathologist, medical laboratory scientist, technician, clinician, and other allied and support staff who make the invaluable contribution to patient care that we see every day. Thank you all for being here, for your unwavering commitment to the science and art of pathology, and for dedication to improving the health of our communities. I look forward to today's discussions, presentations, and exchanges of ideas that will inspire and propel us forward. Thank you for your dedication and unwavering support. I wish us all a fruitful and engaging World Pathology Day celebration. Thank you.
Let's appreciate him once again with a round of applause, please. In the course of his presentation, we had joining us in this great hall, the Nightingale Hall, the Chief Medical Director and Chief Host of this program, Professor Abdullahi Da Silva Yusuf, ably represented by the Chairman Medical Advisory Committee, CMAC, Professor S.A. Biliaminu. He'll be wearing two caps here today as a CMAC and also the Chief Host of this program. Let's appreciate him while he proceeds to the high table, please. We also had joining us in this great hall, the Executive Secretary, Kwara State Hospital Management Board, Dr. Abdurrahim Malik. Please Please proceed to the high table, sir. We appreciate you for joining us. Let's appreciate it with a round of applause, please. Thank you very much. I would like to recognize the presence of the HOD, ONG, Professor Olarin Oye. Please rise up for recognition. We appreciate you, man. Our third honoree, elder, to be honored here today, Professor A.B. Okeshino. Please rise up for recognition, sir. Thank you so much for coming, sir. Thank you so much. We will now proceed to the next aspect of our presentation of our program today, which is the remarks from the chief host. Our chief host is wearing two caps today, the CMAC, and also as the chief host of this program, as the three caps. Okay, Ilanti is wearing three caps. A member is a pathologist, is a member of the CNP, and is equally here on the capacity of the CMD and the chief host of this program, and also is here on his own capacity as a CMAC. Professor S.A. Biliamino would like you to give us your remarks, sir.
Good morning, the chairman of this occasion, Professor Chijoke Mayoga. Good morning, sir. The keynote speaker of today, Professor S.S. Taiwo, the chairman of Nigerian College of Pathologists, that's Dr. Suleiman Akambi, the acting head of nursing services, ably represented today, the executive secretary also managing board, Kwara State. You're welcome. The head of department present here today, my professors, my organs, pathologists on the ground, medical representatives on the ground. I welcome everybody on behalf of the Chief Medical Director, Professor Abdullah Asifa Yusuf, who is unavoidably absent today. He will have been here physically, but because he has to travel maybe to attend to some important official duties and present outside the state. On his behalf, I welcome everybody to this year's edition of International Pathology Day 2024 that is being organized by us, that is the College of Nigerian Pathologists, Kwara State branch. Today's keynote lecture titled The Global Antimicrobial Resistance, as well as the symposium titled Teamwork in Clinical Practice, a sine qua non in improving patient safety in diagnosis and management, are all very, very topical and cannot be taken later than now. The time is now. The concept of antimicrobial resistance occurs when bacteria, viruses, fungi, and parasites no longer respond to antimicrobial medicine or agents. And as a result of this double resistance, antibiotics and other antimicrobial medicines become ineffective and infections become difficult or impossible to treat, increasing the risk of disease spread, severe illness, disability, and death. Let us make it known today that is, when we are talking about antimicrobial resistance, we are not only talking about human beings, because it also occurs in plants as well as in animals. AMR is a natural process that happens over time through genetic changes in pathogens. Its emergence and spread is accelerated by human activity, mainly the misuse and overuse of antimicrobials to treat, prevent, or control infections in humans, animals, as well as in plants. This is very, very enormous. That is AMR, as it is one of the top global public health and development threats. It is estimated that bacterial antimicrobial resistance was directly responsible for 1.27 million global deaths in 2019 and contributed to 4.95 million deaths in 2023. The misuse and overuse of antimicrobials in humans, animals, and plants are the main drivers in the development of drug-resistant pathogens. AMR affects countries in all regions and at all income levels. Its drivers and consequences are exacerbated by poverty and inequality, and low and middle income countries are mostly affected. The symposium, on the other hand, titled Teamwork in Clinical Practice, a sine qua non, is also very, very timely. The era of that the patient belongs to me is gone. The concept now is multidisciplinary approach to managing patients. And everybody has already gotten role to play. Whether you are a physician or as medical laboratory physician or medical laboratory scientist and so on and so forth. Today, we have Professor S.S. Taiwo, a former Dean of Basic Medical Sciences, as well as former Provost, College of Health Sciences, Ladoke Akintola University, and presently, our Editor-in-Chief at the Faculty of Pathology, and that's for Annals of Pathology. He is a seasoned medical microbiologist, and I'm quite sure that today is going to give a very good deal to the topic of today. On the other hand, our symposium is also very, very much necessary. We should all look at ourselves as just one in managing our patients. Everybody has already gotten a role to play, whether as a physician, laboratory physician, lab technician, medical lab scientist, and so on and so forth. On behalf of the Medical Director, I wish to formally declare today's International Pathology